Spencer Kobren's The Bald Truth.
One of the things I'd like to discuss with you, Spencer, is the use of platelet-rich plasma.
Okay.
As you probably know, many people are advertising the use of platelet-rich plasma. We see it in everything from orthopedics to cosmetic surgery.
I don't mean to cut you off or laugh. When you say everybody, I mean it is like an epidemic here in Los Angeles. There are, honestly, I'm not even joking. There are vans parked on the side of the street promoting PRP for hair loss. Yeah.
I can believe it. It's covering every part of your body from your joints to your genitalia.
Yeah.
It's quite peculiar.
Oh, yeah. There's a guy here in L.A., he calls it the P shot, and making all kinds of claims. And believe me, there are guys who are willing to be injected down there if they think they can get, just a half an inch.
Absolutely.
Yeah.
So the point I'd like to raise is that while people use the same acronym, PRP, and we talk about platelet-rich plasma, the platelet-rich plasma from one institution to another institution or from one system, as there are many PRP systems, can be quite different. And I actually did a small study myself where we tested about 6 or 7 different systems. And what we found was that some of the platelet-rich plasma systems actually did not even concentrate the platelets to any significant degree. So people are injecting PRP, and the patient has no idea what they're getting, nor does the clinician even bother to know what the patient's getting in terms of concentration of platelets, and whether there are red blood cells, whether there are white blood cells. There are so many different permutations for the use of PRP that unless we start talking about the same things, we're not going to really be able to compare results. So my point is that we use a system that's been very reliable. As I mentioned, I tried 6 or 7 of them. And the system that we use seems to concentrate platelets anywhere from 6 to 12 times the normal concentration. And we test every patient before we draw their blood. We know what their platelet concentration is. And then we test the platelets once we have obtained them. So the next day, if the patient wanted to, we could tell them what their platelet concentration actually was. And I think that's important. And we can tell them how many red blood cells. We can tell them whether there were white blood cells. That's a little different study, but we can do that.
Well, I mean, it's beyond just important. The one thing that I've always been saying, and I do believe in PRP therapy or treatment for hair loss, but not all PRP is created equal. And frankly, most of what people are offering, and now you have essentially been able to demonstrate this with this study, is complete bullshit. They're not helping anybody. They are just re-injecting, a person's own blood back into their scalp. So they're going through the process of having the blood drawn. They're going through the process of having all these needles injected into their scalp, and there's no benefit. And they're also probably on average of about $1,500 out of their wallet for absolutely no benefit.
Yeah, you're absolutely correct. And the thing becomes that patients really are just not aware of these variations that occur. And so it's quite possible that, as you mentioned, you could be getting nothing. And that would account for some of the variability in the studies. You may know that a few years ago now, I think Dr. Puig in Houston did a study for female pattern alopecia, and they found that their results with PRP were very disappointing, that they didn't get much of a reaction. And then you look at other people who've done studies and you get, very nice results.
Right.
And in our hands, we're getting very nice results with the PRP. But I would say in almost all the studies, very few of these people are comparing the same systems. And unless you're comparing the same systems and doing these counts, I think you're going to be far off. And there are other considerations as well. How deep do you inject? How much do you inject at each site? Is there an inhibitory concentration? We haven't answered these questions, let alone what protocol should we be using. Some people inject every week for a while. Some people inject every month. And there are variations all the way, to once or twice a year. So
yeah, I was just
those answers yet.
I was just at a conference where one dermatologist from Texas, and she actually gave one of the better talks, I'd say, from the talks that I was that I actually was able to watch. But in her protocol is start kind of load patients up, do one procedure a month for the first 3 months, and then do it quarterly. In her practice, the claim is she's getting pretty consistent results. But with that said, we have no idea. Is she using an open system or a closed system? Is it an FDA approved system? Is it, what exactly is being used?